Welcome to Real Women, Real Issues. I have Tracy Purnell with us today, and we're going to talk about troubled children in the home, what you should do, and maybe some advice that you can take and help those children out. Thank you and welcome.
Thank you.
I know this may be a loaded question, but how do you determine a troubled child? A troubled child?
Well, it's interesting that you say it's a loaded question, because it is, and for families it's even more loaded or interesting for them. Oftentimes, it really begins to surface the behaviors when they enter school, kindergarten. It starts a little earlier, and parents could recognize, okay, maybe it's something going on, but I'm not quite sure what is going on, because again, children have to develop and they have to learn to be independent, and oftentimes they want to show their independence, or they may have issues with their siblings or things. However, once they enter the school system and they have to interact with individuals outside of their family, that's when you may get a call from a teacher and say, okay, hey, something's going on here. I need some intervention. I need for you to tell me if it's something going on in the home, or I need your help. Your child is not behaving appropriately or socializing appropriately with the other students, or even paying attention in class.
Okay, so say that's been done. I have a parent, I have this child who's 5, 6, kindergarten, just starting school. I get a phone call from the teacher, such as you just described. What do I do now as a parent?
Well, first thing you want to do is continue to work with the teacher. Maybe come up with a way to be more consistent in the home and in the school. You might want to follow up with the pediatrician to make sure there is no developmental issues that could possibly be going on. What you also want to do is seek help as soon as possible. It may not be to the point where you may need individual counseling, or you may need any medication for the behavior. You may just need to seek help maybe from the school to see if they have any support services in place, or if you can talk to the pediatrician, see if there's any support group. You may want to enlist maybe someone in your community or the school to help maybe redirect some of the behaviors. And if that doesn't help, then I would say move forward with getting some professional treatment as soon as possible.
Now, are there some sort of tests that the child would take to determine exactly, what avenue that needs to be taken?
There's various tests that can be administered to a child. The best test, though, is observation, self-report. But what you can also do, again, if you take the child to the pediatrician and they determine that there may be some developmental things going on, they can help you with maybe some neurological testing, additional neurological testing. However, if you take the children to a psychologist, they can do a lot of testing. They start with maybe the Connors to see, and they work with the school, and then they will give them an assessment to determine.
And the Connors, what exactly
is that? The Connors is a behavior test, whereas they will give the teacher various forms to complete, and they pretty much track the child's behavior in school. The parent also do the same thing. They track the child's behavior at home. You take that back to the psychologist, and they will come up with a report on what they can determine could possibly be going on with the child.
So it's sort of an observation, basically, from a home aspect and also from the school.
Yes, and then they'll also do other tests. They have self-esteem tests. They may have just intellectual tests and those type of things, maybe a depression test for the student or the child that can be delivered at the clinic or even at the school.
So when a child comes to you, it's the first thing you do is to administer this test?
Well, for me, if a child was to come to me for help, I would do an intake or an assessment, determine what could possibly be going on. I will also review any medical records, and as well as maybe refer the child to a psychiatrist, or so they can administer those other psychological tests. Once I get all that information, I can come up with an assessment and a treatment plan, and to help the parent work with the child a little better.
We'll be back with more on the troubled child, but first we're going to go to Jungle Juice for the Juice of the Week.
Thank you, Ardelle. Hi, my name is Regina Hunter-Coleman.
And I'm Sarita Hunter-Doss.
This week we'll be juicing carrots, a very simple drink, but it's extremely potent and very nutritious. You want to get started?
All right, let's go. So I have about 6 carrots here. This is actually one of my favorite drinks. Not only because it tastes so great, but carrots are also one of the highest vegetables in nutritional value. From a carrot, you can receive vitamin A, C, D, and E.
that was about 6 carrots, and it's just about 8 ounces of juice. It's just about 8 ounces of juice. Carrots are known to be really good for your vision. It's good for cancer prevention, anti-aging, healthy glowing skin, to help prevent heart disease, cleanse the body, and it's good for your teeth and your gums.
All right.
Okay.
Cheers to carrot juice.
And if you don't know, carrots are extremely sweet. Sometimes people add apple juice to it, but you don't have to because it's so sweet. It's a really good drink. Very delicious.
So good. Thanks for tuning in to Jungle Juice Bar. And remember, your health is your wealth.
Try the juice of the week and much more at the Jungle Juice Bar. The Jungle Juice Bar is located on Charlevoix in Grosse Pointe Park.
We're the Cronin Law Firm, bringing more to the table. When we sit down together, we share our expertise. You've got a legal problem, we know you need relief. Advice that you can trust, that's why people come to us. We're the Cronin Law Firm, bringing more to the table.
We fix hearts, we fix heads, we do eyes and ears, noses and throats. In fact, more children come to Children's Hospital than any other hospital in the state. Stop the headaches, stop the pain, fix the tummies, the ankles, the toes, and fingers.
Emergency? When it's your child, don't settle for less. Trust the pediatric ER experts at the Children's Hospital of Michigan at the DMC. The ER at Children's Hospital.
Always there, just for them.
My friends, I want to introduce you to Samasco Financial. As attorneys, they worked hard to protect clients on a legal basis, only to watch many lose their money in the unpredictable and risky stock market. Samasco Financial has recognized the need for asset protection for our seniors and has introduced investment planning that will grow your nest egg without the risk of loss. To find out more about how Samasco Financial can protect your financial future, call 586-493-9989.
Real Women, Real Issues is brought to you by Mike's Fresh Market.
Welcome back to Real Women and Real Issues. I have Tracy Purnell with us, and we're talking about troubled children today. And thank you again for coming. I know if you have a home and there is a troubled child there, what should you do? Should we take them out of the home if we find that the help that we're seeking, we've done the testing, and there doesn't seem to be any help?
As a last resort, because oftentimes if you remove them from the home and when you bring them back, if you haven't solved the issues as a family, it's going to continue. So removing the child out of the home, I would say to go there as a last resort.
What if you find out you have a child that has issues in school, maybe picking fights, not listening to the teacher, but it's not the child that has the problem, it may be the parent. Maybe it's a single parent home, there's too much stress on the mom, other issues may be going on, they may have a drinking problem, but they're causing this child to act out in school. How do you determine that? Because as adults, I know we can put on personas and everything looks okay for 20 minutes for a social worker.
Well, you know what? I start with the family in general. If you have a child that may be acting out in the home or in school, the approach is to work with the entire family, because one way you can kind of get the families involved is to let them know that, you know, in order for me to help your child, I have to treat the entire family. Because if I'm treating the whole family, once I'm out of the picture, you can take those tools and techniques and continue to work with the child.
But if the adult is the one that needs the help, how do we do that?
Gently. What you want to do is try to encourage them to seek treatment also. Come up with a family plan as opposed to an individual plan for just that particular child. And hopefully, with some coaching and some counseling, the family or the parent will see that, our entire family needs help and not just the child.
I know you probably don't look to do this on the onset, but in some situations, I'm sure you have to remove the child from a home. Do you make that determination, or is there someone in joint with you, or what?
No, I've never had to make that decision alone. As a therapist working with a family, oftentimes, but when they came to me, the child was probably already removed from the home. So it was my job at that point to make recommendations to the court system as to whether or not the child should be placed back in home. However, if I'm working with someone and there appears to be some abuse or neglect going on, I have to report that, and then the child may be removed. But again, it won't be totally my decision. My job will be to help the family understand why that decision was made.
Now, once a child is removed from the home, do you see that if they're in a foster care setting, I'm assuming that would be the next step from the home?
Yes, either foster care or residential treatment facility, with the whole goal of reunification as soon as possible. Because again, once you remove the child, if you do not continue to work with the family and the child together, you're never going to solve the issue.
Then do you work with them once they get back into the home?
Absolutely, yes.
And then how long does that take? Is that a
That is, it varies. It varies because again, it's just based on what's actually going on, what were some of the issues, and if it's severe enough, it may take a little longer, may take a year or so. However, if it's something that you can teach, skills you can teach the family on how they can overcome some of their challenges or deal with those behaviors, much shorter time.
Now, when you say there's a, I don't know, I'm using that term, troubled child, is that a correct term to use, or what do you use?
I wouldn't say a troubled child. I would say a child that maybe experienced some challenges at that particular stage in life. And it's probably something going on in the home or with the particular child at that particular developmental stage.
I know with another job that I actually do, I work with children, and I had a child come and tell me that he had anger issues and he needed some help with that. We aren't equipped to do that. It's like a long process. What would you advise for me, instance, that he came to me, he told me that because he's been having issues. What should I do?
I would recommend that he talk to someone who provides community mental health services in the neighborhood. Like, for instance, where I work in Team Mental Health, we provide community mental health for the adult population. However, we work with other organizations that we can refer someone with issues with their child to, and they will be able to provide anger management courses for that particular child and family.
And I think that's something that needs to be in all the schools today.
Absolutely, absolutely.
I want to thank you for being with me today.
Well, thank you for having me.
And we'll be right back with Jerry Coy with more on The Troubled Family.
When needed.
Team Mental Health Services prides itself on going the extra mile for its members.
And it was towards the 6th court date. I finally stood up and said, I can handle this process the rest of the way. And it was all because of the motivation and encouragement I got from Team Mental Health staff.
Team Mental Health Services, because we care and you can.
Opportunity. It doesn't stare you in the face. It's not going to yell at you to come and get it. It doesn't knock. So what does opportunity look like? Not what you might think. You see, opportunity is not a right. It's definitely not equal. And it doesn't come with an instruction manual. That's because opportunity isn't found. It's molded, it's built, it's created. It's as much about grit as it is intellect. An explosive high-tech corridor located at the intersection of muscle and brains? You bet. Because opportunity only comes to those already in the game. What does opportunity look like? It looks like Detroit. Opportunity made in Detroit.
Mike's Fresh Market, Detroit's largest independent supermarket with the best prices, quality, and service. Enjoy our vast selection of fresh fruits and vegetables. Wide aisles lead you to our own in-house bakery and deli. Beef, pork, chicken, seafood, and much more. You can rest assured you will feed your family the freshest food in town. Whatever you need, you can find it here at Mike's Fresh Market. Mike's Fresh Market with 2 locations, Gratiot and 7 Mile and Livernois and 7 Mile. Better food, better prices. That's Mike's promise.
Welcome back. We have with us now Jerry Coy, and we're going to discuss a troubled home, having a child in a troubled home, and what type of help you need to seek. Thank you.
Good morning. How are you?
I'm great, and yourself?
Very good.
Tell me, when you have a troubled home, be it a drug-addicted family member who's in the home, a child who needs to be on maybe some sort of medicine, what is the first step that family should take?
The first step we encourage families to take is to call our screening center to determine if The problem they're having is one that we can assist with.
Okay.
We want to be able to determine whether there's a medical reason for what's happening or if there's a behavioral cause behind their concerns.
Now, when they call this line, is this to your place of employment where you work?
Yes, we have a call center at Team Mental Health Services. We're
Okay.
located in the eastern market area of downtown Detroit.
Now, once they make that phone call and they determine it's not just a health issue, they have maybe some mental instabilities, what is the next step? What do they do?
We schedule them for an intake appointment where they can come in and talk to a treatment team to have us identify what behaviors have been occurring, what initiated their development, what steps the family has taken so far to resolve the issue, and what alternatives we can suggest to help the family gain more control over what's happening.
Sometimes the issue may have escalated, and it may not be healthy to keep maybe young children or even the husband or the wife in that situation. What do you advise to those people, and what type of situation do you think that occurs?
We're very interested to talk to those families that feel that conditions have reached a level of risk that some type of emergency intervention is necessary. We can suggest domestic violence shelters for family members that need that safe haven. If there is a need for temporary housing or a temporary shelter for a child or adolescent, we can refer to an agency in the community that can assist with that. But we very much want to have families be safe in seeking treatment.
Sometimes the person who actually needs the help doesn't think they need anything. How do you address that if it's someone in the home who needs to get the help but they're not going to go, they don't feel there's anything wrong with them? What do you advise? Do you call and actually have the police come in that type of situation?
In a situation like that, we really want to avoid the police becoming involved because that tends to impose a heavy hand of authority on the situation. We'd like to be able to talk to a family about what's happening in the family, that some people have concerns regardless of who's to blame or who has the accountability for fixing it. We're very committed to helping families retain and develop further control over their own lives. We're not there to impose our will or advice on a family.
Are you inpatient? So when someone comes to you, do they actually stay in-house for a period of time?
We're an outpatient mental health facility. We do work with some crisis centers and inpatient facilities if that's needed, but we really see inpatient hospitalization as a last resort. We have a number of effective alternatives and treatment plans that work to help people regain a sense of control, improve their mental health, and stay in their community living situation.
But sometimes I'm sure that's not the situation. You have to go to an inpatient facility.
In some situations where an individual's health and safety is at risk, or they may be of harm to themselves or others, we do have to recommend an inpatient course of action. But we are committed to that short hospital stay being intensely effective so that we can assist and intervene as the outpatient provider. The days of long-term inpatient stays are far behind us.
We're going to come right back and get more information, but first we're going to hear the dermatology tip of the week with Dr. Shauna Diggs.
We are beautiful in every single way. Yes, words can bring us down.
Hi, this is Dr. Shauna Diggs. I'm here with your skincare tip for the week. As you know, this time of year many people start getting itchy skin rashes. So when people come in the office, there are a couple questions that I ask in order to find out the cause. One, sometimes people have hereditary eczema, or they get pink, scaly, itchy rashes at the bends of their arms, behind their knees, or behind their neck. Sometimes that'll flare with heat and perspiration in the spring and summer. The second cause can be an irritant eczema, which can sometimes happen from different detergents, different chemicals in plants when you're gardening, and related to that can be poison ivy, which is an allergic contact dermatitis, where you start to get little blisters after gardening in lines, usually on the arms or the neck or the face. Thirdly, people can have eczema that comes related to allergies or hay fever. So many times if your allergies and hay fever flare, you can also have a flare with an itchy rash. Sometimes flares up with heat on the back, chest, or the waist. For all of these rashes, we can use cortisone treatments. Things like triamcinolone or hydrocortisone. You can get hydrocortisone over the counter, but from your physician, you can get a much stronger version that can usually take the rash away in a week or two. You can also use antihistamines like Benadryl, Claritin, Zyrtec, or Allegra over the counter. Lastly, we can use anti-itch medications. Some things that have menthol in them, sort of icy hot, can take away the itching. We also have some healing creams that can help with itching, like Hyalotopic or Neosalus, that can also help, and those are prescription. And then there's some other prescription medicines like Ardelle or Protopic that can help with eczema. So if you get an itchy skin rash, see your dermatologist or your primary care physician for treatment. And that's your skincare tip for the week.
To learn more about Cosmetic Derm and their revolutionary skincare products and services, please visit drshaunadiggs.com.
Mike's Fresh Market, Detroit's largest independent supermarket with the best prices, quality, and service. Enjoy our vast selection of fresh fruits and vegetables. Wide aisles lead you to our own in-house bakery and deli. Beef, pork, chicken, seafood, and much more. You can rest assured you will feed your family the freshest food in town. Whatever you need, you can find it here at Mike's Fresh Market. Mike's Fresh Market with 2 locations, Gratiot and 7 Mile and Livernois and 7 Mile. Better food, better prices. That's Mike's promise.
My friends, I want to introduce you to Samasco Financial. As attorneys, they worked hard to protect clients on a legal basis, only to watch many lose their money in the unpredictable and risky stock market. Samasco Financial has recognized the need for asset protection for our seniors and has introduced investment planning that will grow your nest egg without the risk of loss. To find out more about how Samasco Financial can protect your financial future, call 586-493-9989.
We fix hearts, we fix heads, we do eyes and ears, noses and throats. In fact, more children come to Children's Hospital than any other hospital in the state. Stop the headaches, stop the pain, fix the tummies, the ankles, the toes, and fingers.
Emergency? When it's your child, don't settle for less. Trust the pediatric ER experts at the Children's Hospital of Michigan at the DMC. The ER at Children's Hospital.
Always there, just for them.
ETX Closed Captioning is sponsored by the Detroit Seafood Market.
Welcome back. We have with us today Jerry Coy, and we're talking about troubled homes, troubled families, and how to keep them together. Thank you and welcome again for being with us and giving us all of this wonderful information and insight. I know we talked briefly about not wanting to keep the stay in the hospital. You said that the long stays are no longer around, people
Correct.
no longer do that. But I know I hear maybe even on advertisement or some people say that that's the only way that people can get help is to get away from their environment or their circumstances for long periods of time. Do you agree with that or you do not?
I disagree with that because one of the fallacies in that line of reasoning is if the only way to get people well is to remove them from their situation, then putting them back in that situation is regenerating the same problem. We take a proactive approach that the family has within themselves the ability to resolve problems and remain together as a family system. So we're looking at fixing the problem right where it occurs.
If you have children in the home, do you advocate them being involved and having an open dialogue on exactly what's going on? If there's health issues as far as even drug abuse or gambling addiction or anything of that sort?
I think to some degree we would want that input. The challenge is how old the child is and whether the subject of conversation is going to be helpful or distracting. If I'm working with a family and they're dealing with sexual abuse, that might not be an appropriate involvement to have a child participate in. But if we're talking about difficulty with school attendance or performance of chores in the home, children already are affected by what's going on. They have opinions and they have ideas, and part of the stressors that occurs in a family is no one listens to them.
Now, do you seek help for them along with one of the parents while they're getting their help? Do the children also receive some sort of help?
If the children appear to need some counseling assistance, we most definitely are going to hook them up with one of our sister agencies in the downtown community that work effectively with them.
Now, where are you located?
We're in the Eastern Market area of Detroit, across from Shed 5. Our address is 2925 Russell Street. Our administrative headquarters is at 921 Howard Street in Dearborn. And we have a downriver location on the Toledo-Dix Road in Southgate.
Now, how long have you been working in this business?
I've been working in this business for 36 years. I'm in my 3rd year with Team now.
And your background is?
I have a bachelor's and a master's in social work, and I am concurrently pursuing a master's in divinity.
So did you always know this is what you wanted to do?
I actually wanted to be a teacher, and when I graduated high school in the early 70s, the guidance counselor said there's no job for teaching. So my second interest was behavioral services, and I've really enjoyed being able to work with kids, families, and couples.
I'm sure when you are helping people, do you hear things sometimes that come out that you actually go into the home and fill it out and see how things are and make suggestions?
We periodically do home visits, and one of the underpinnings of our services is making suggestions or offering ideas. Effective therapy is not so much telling people what to do as instead saying, I hear you saying that these things have worked for you and you might like to do more of them, or those things haven't helped at all and you need to do less of them. So we're not about the business of giving advice, we're about the business of helping people to empower themselves.
Now there's a team, as I understand. So if there's someone who comes to you and for whatever reason it doesn't work, be it personality or even background of expertise in that particular location or field of what they're dealing with, do you have someone in your office or in your facility that can help, or do you refer them out?
We have a variety of disciplines in our office. We have just developed a dental program. We'll be having an optician. We'll have a medical doctor available. We have psychiatrists, licensed practical counselors, case managers, peer support specialists. The services that we can't deliver, we can connect people with resources in the community. So our hope is that people call us with questions, not necessarily the fact being that we can process all of their solutions, but we want to invite the questions.
We want to thank you again for being with us today.
Thank you. I appreciate the opportunity.
And we want to see you next week right here on Real Women, Real Issues.